Introduction to diabetes. Diabetes is a chronic medical condition that disrupts the body's ability to manage blood glucose, often referred to as blood sugar. Glucose serves as the primary energy source for our cells and is derived from the foods we consume. In a healthy body, the pancreas produces insulin, a hormone that facilitates the entry of glucose into cells for energy use. However, in individuals with diabetes, either the body produces insufficient insulin or cannot utilize the insulin it does create effectively. This dysfunction leads to an accumulation of glucose in the bloodstream, resulting in elevated blood sugar levels. Diabetes is generally classified into three main types: type 1, type 2, and gestational diabetes. Each type has distinct causes and mechanisms but shares the common issue of impaired glucose regulation. Type 1 diabetes. This is an autoimmune disorder in which the immune system mistakenly attacks the insulin-producing beta cells in the pancreas. Typically diagnosed in children or adolescents, those with type 1 diabetes require lifelong insulin therapy to manage their condition. Type 2 diabetes. As the most prevalent form of diabetes, type 2 occurs when the body develops insulin resistance or does not produce sufficient insulin. This type is often linked to lifestyle factors, including poor dietary choices, inactivity, and obesity, although genetics also play a significant role. Gestational diabetes. This type emerges during pregnancy when the body cannot generate enough insulin to meet heightened demands. Although gestational diabetes usually subsides after childbirth, it can increase the likelihood of developing type 2 diabetes in the future. Diabetes extends beyond mere blood sugar management. If not properly managed, it can result in severe complications such as heart disease, kidney failure, nerve damage, vision impairment, and even amputations. Effective diabetes management requires a blend of lifestyle modifications, medication adherence, and consistent blood sugar monitoring. While there is currently no cure for diabetes, it can be effectively controlled, enabling individuals to live healthy and fulfilling lives. Given the rising incidence of diabetes globally, it is essential to understand its causes, symptoms, and management strategies. Early detection and appropriate care can significantly lower the risk of complications, underscoring the importance of awareness and education in combating diabetes. Accepting the diagnosis. Education. Understanding diabetes is the first step toward effectively managing it. Familiarize yourself with the different types, including type 1, type 2, and gestational diabetes. Engaging with your healthcare provider or a certified diabetes educator can help clarify what your specific diagnosis means and what to expect. Mental health. Acceptance plays a crucial role in adjusting to your diagnosis. It's common to feel overwhelmed, experiencing emotions such as frustration, fear, or sadness. Seeking psychological support, whether through therapy or support groups, can help you navigate these feelings. Building a healthcare team. Primary care physician, PCP. Your PCP will coordinate your overall diabetes management, including medication prescriptions and progress tracking. Endocrinologist. For more complex cases, particularly with type 1 diabetes or hard-to-manage type 2 diabetes, consulting an endocrinologist can provide specialized care. Dietitian/nutritionist. Nutrition is vital for blood sugar control. A certified diabetes dietitian can tailor meal plans, teaching you about carb counting, portion control, and long-term healthy eating habits. Certified diabetes educator. This professional specializes in diabetes management, offering guidance on various aspects, from insulin administration to blood sugar regulation during physical activity. Specialists. Regular checkups with an ophthalmologist, cardiologist, and podiatrist are important, as diabetes can impact different organs. These appointments help prevent complications related to eye, heart, and foot health. Daily blood sugar monitoring. Glucometer. Regular self-testing is essential. Most individuals with diabetes should check their blood sugar at least once a day, depending on their treatment plan. This practice helps you understand how food, activity, and medications affect your blood sugar levels. Continuous glucose monitoring, CGM. This advanced method uses sensors to track blood glucose levels continuously throughout the day and night, offering real-time feedback. Record keeping, keeping a journal or using apps to log your blood sugar levels, meals, activities, and stress can help identify patterns and optimize your management plan in collaboration with your healthcare provider. Diet and nutrition, the cornerstone of diabetes management. Carb counting. Since carbohydrates have the most significant effect on blood sugar levels, learning how to count carbs and adjust meals is essential for both type 1 and type 2 diabetes. Glycemic index, GI. This system ranks carbohydrates based on their impact on blood sugar. Focus on low GI foods, such as whole grains, legumes, and non-starchy vegetables, while avoiding high GI foods like sugary drinks and refined grains. Portion control. Keeping portion sizes reasonable helps prevent overeating and stabilizes blood sugar levels. Meal planning. Balanced meals. Combine lean proteins, healthy fats, and fiber-rich carbohydrates to slow digestion and minimize blood sugar spikes. Consistency. Aim to eat at the same times each day to maintain stable blood sugar levels. Smart snacks. Healthy snacks, like nuts, yogurt, or veggie sticks with hummus, can help keep blood sugar in check. Hydration. Drink plenty of water, and steer clear of sugary drinks, sodas, and fruit juices that can cause blood sugar spikes. Physical activity. Exercise benefits. Regular physical activity enhances insulin sensitivity, aids in weight management, and helps lower blood sugar levels. Types of exercises. Aerobic exercise. Activities such as walking, swimming, cycling, and jogging support cardiovascular health. Strength training. Lifting weights or performing bodyweight exercises, like push-ups and squats, builds muscle and improves glucose uptake. Flexibility and balance. Incorporating yoga, Pilates, and stretching can reduce stress and enhance overall well-being. Timing and monitoring. It's crucial to monitor your blood sugar before, during, and after exercise, particularly if you're on insulin or medications that can lower blood sugar levels. Managing stress. Stress response. Stress can elevate blood sugar levels by releasing hormones like cortisol. It's important for individuals with diabetes to recognize and manage stress effectively. Techniques. Mindfulness meditation, deep breathing exercises, and yoga can all be beneficial for reducing stress. Medications and insulin. Oral medications. Many individuals with type 2 diabetes take medications like metformin to help regulate blood sugar. Always take these as prescribed. Timing of medication. Consistent medication timing and adherence to dosing instructions are crucial for effective blood sugar control. Carrying glucose. Always keep glucose tablets or a sugary snack handy in case of hypoglycemia, low blood sugar. Preventing and managing complications. Foot care. Diabetes can lead to nerve damage and poor circulation in the feet, diabetic neuropathy. Inspect your feet daily for cuts, blisters, or infections. Wear comfortable, supportive shoes, and avoid walking barefoot. Eye health. Regular eye exams are essential for monitoring diabetic retinopathy, which can lead to blindness. Kidney health. Diabetes can cause kidney damage, known as diabetic nephropathy. Regular urine tests and blood pressure management are vital for preventing kidney issues. Cardiovascular health. People with diabetes are at a higher risk of heart disease and stroke. It's important to manage blood pressure, cholesterol levels, and blood sugar to avoid cardiovascular complications. Dealing with hypoglycemia, low blood sugar. Recognizing symptoms. Be aware of signs of low blood sugar, such as shakiness, sweating, confusion, irritability, and dizziness. Immediate action. If your blood sugar falls below 70 mg per deciliter, consume something sugary, like glucose tablets, juice, or candy. Recheck your blood sugar after 15 minutes to ensure its return to a safe level. Social support and community. Family and friends, a supportive network is vital. Educate your loved ones about diabetes and how they can assist in emergencies, such as recognizing signs of low blood sugar. Online communities. Explore diabetes blogs, forums, and social media groups for resources, encouragement, and information. Staying informed. Continuous learning. Diabetes care is continually evolving. Stay informed about the latest treatments, technologies, like continuous glucose monitors and insulin pumps, and research advancements. Apps and tech. Utilize diabetes management apps to monitor food intake, activity, and blood sugar levels. Some apps also send medication reminders and can log data from glucometers and CGM devices. Setting realistic goals. Short-term goals. Concentrate on daily blood sugar control, adhering to medication regimens, and making healthy food choices. Long-term goals. Collaborate with your healthcare team to manage your A1C levels, average blood sugar over 2 to 3 months, maintain a healthy weight, and prevent complications. Celebrate success. Recognize and celebrate every positive change, regardless of size. Managing diabetes is a marathon, not a sprint. Conclusion. Navigating life with diabetes is a journey that demands a holistic and proactive approach to health. From accepting the diagnosis to assembling a dedicated healthcare team, self-management is vital for leading a healthy and fulfilling life. Regular blood sugar monitoring, a balanced diet, consistent exercise, and effective stress management are critical elements of everyday care. Additionally, staying informed about the latest advancements in diabetes treatments and technologies can significantly simplify management and improve efficiency. While medications and insulin therapy are essential for stabilizing blood sugar levels, they represent only part of the overall picture. Making lifestyle changes, such as adopting a nutrient-rich diet and engaging in regular physical activity, can provide long-term advantages by preventing complications and enhancing overall well-being. Furthermore, being able to recognize and react to blood sugar fluctuations, especially in cases of hypoglycemia, is vital for immediate safety and long-term health. Preventing complications related to diabetes, including cardiovascular disease, neuropathy, and kidney damage, requires ongoing vigilance and routine checkups with specialists. Simple practices, such as inspecting your feet daily and scheduling annual eye exams, can significantly contribute to maintaining a high quality of life. Support networks, whether from family, friends, healthcare professionals, or online communities, are invaluable for providing emotional strength and practical advice, helping to alleviate the sense of isolation that often accompanies chronic conditions. Ultimately, living with diabetes involves balancing various aspects of health, a skill that can be honed over time with knowledge and support. With commitment and the right resources, it is entirely possible not only to manage diabetes effectively but also to thrive, transforming the condition into a manageable part of life rather than a hindrance. Thanks for watching. If you found this video helpful, please give it a thumbs up and share it with others who might benefit. Don't forget to check my links below for more resources and support. Consider subscribing to stay updated with more tips and tutorials on managing diabetes and improving your overall health. Stay strong, and take control of your journey with diabetes.